By the time you turn 65, there is an 80% chance your prostate has grown to the size of a lemon or even a baseball, completely altering how your body functions. Most men over 60 are told that getting up 3 times a night to use the bathroom is just a normal, harmless part of getting older, a tax you pay for reaching retirement. But that is a dangerous myth. Ignoring the subtle changes in how you urinate isn't just about losing a good night's sleep or ruining your back nine on the golf course. It can secretly pave the way for irreversible bladder damage, sudden kidney failure, or advanced conditions that are far harder to treat if caught too late. I am Dr. Carl. I have spent the last 16 years practicing as a urologist, helping thousands of men reclaim their health, comfort, and independence. Today, we are going to walk through the 8 definitive signs that your prostate is in serious trouble, conditions that every man over 60 needs to recognize before minor annoyances turn into a medical emergency. We will cover everything from the hidden meaning behind your nighttime bathroom trips to a specific type of lower body discomfort that most seniors completely misdiagnose as simple lower back pain. Pay close attention to sign number 6 because it is the most frequently overlooked indicator of a looming crisis, and catching it early can quite literally save you from an unexpected trip to the emergency room. Before we dive into the first sign, I want to ask you a quick question to help me tailor my future videos to what you actually need. How many times are you currently waking up in the middle of the night to use the restroom, and how long has that been happening? Drop your answer in the comments below, because I read every single comment, and your real-world experiences directly shape what medical topics I cover next on this channel. Let's begin with the first warning sign, which is a weak or hesitant urine stream. You might notice that when you stand at the toilet, it takes a few seconds or even a minute for anything to happen, or the flow feels slow, sluggish, and constantly interrupts itself. Think of your prostate like a small donut wrapping tightly around a garden hose, which is your urethra. When that donut swells and hardens as we age, it squeezes the hose, forcing your bladder muscle to work twice as hard just to push fluid through a tiny, restricted opening. Research published by the American Urological Association shows that this progressive weakening of the stream is one of the most reliable clinical indicators of significant prostate enlargement. This week, take a moment to honestly assess your flow during your annual physical or your daily routine, and if you find yourself waiting or straining, it is time to schedule a quick routine evaluation. Of course, you should always discuss any changes in your urinary habits with your own doctor before making assumptions about your health. The second critical sign is what we call nocturia, or waking up multiple times every single night to urinate. If you are regularly rolling out of bed 2, 3, or 4 times between midnight and dawn, your body is sending you a clear distress signal. When the prostate compresses the urinary channel, your bladder can never truly empty itself completely, meaning it fills back up to maximum capacity within just an hour or two of you lying down. A comprehensive study in the Journal of Urology highlighted that chronic nighttime urination in older men is deeply linked to sleep deprivation, which elevates your blood pressure and increases the risk of falls in the dark. To take action this week, try eliminating all fluids, especially caffeinated tea or evening cocktails, at least 3 hours before you go to sleep, to see if your nighttime trips decrease. If the problem persists despite cutting back on liquids, it is a clear physical blockage issue, not a fluid intake issue, and requires a professional look. Moving on to the third sign, which is a sudden, uncontrollable urgency to go, often accompanied by leaking before you can even reach the bathroom. You might be driving down the interstate on a road trip or enjoying a family dinner when a powerful, frantic message hits your brain telling you that you have to empty your bladder right this second. Because your bladder has spent months or years fighting against an enlarged prostate, the bladder muscle becomes thick, irritable, and hyperactive, spasming at a moment's notice even when it only contains a few ounces of fluid. Clinical reviews from major institutions like the Mayo Clinic suggest that this urge incontinence significantly degrades a senior's quality of life and independence. One concrete step you can take starting today is to practice timed voiding, which means going to the restroom on a strict schedule every 2 hours, whether you feel the urge or not, to retrain your bladder muscle and prevent it from reaching that panic point. The fourth sign to watch for is a persistent feeling of incomplete emptying, where you finish urinating, wash your hands, walk away, and within 10 minutes you feel like you have to go all over again. It feels like there is always a heavy, lingering reservoir of fluid sitting right at the base of your pelvis that you just cannot push out no matter how hard you try. When the prostate creates a severe bottleneck, the bladder eventually wears out, loses its elasticity, and leaves behind what we call post-void residual urine. Medical data has consistently shown that leaving stagnant fluid sitting in your bladder for hours at a time is a massive blueprint for chronic urinary tract infections and bladder stones. This week, try a simple technique called double voiding. When you finish urinating, wait comfortably on the toilet for 30 seconds. Lean forward slightly to change the pressure in your abdomen, and try to relax your muscles again to see if a second wave of fluid releases naturally. Quick pause right here. If what we are discussing is helping you connect the dots about your own body or a loved one's health, please take 1 second to tap that like button. It truly helps this vital medical information bypass the algorithms and reach more seniors who desperately need to see it before it is too late. And let me know down in the comments if you have ever tried double voiding or noticed a weak stream during your day. Our fifth sign is one that catches many active men completely off guard, and that is a recurrent, deep ache or pressure in your lower abdomen, your pelvis, or even your lower back. Many seniors assume they just pulled a muscle lifting the luggage or spending too much time bending over on the golf course, so they try to treat it with heating pads or over-the-counter pain relievers. However, a chronically overworked, overstretched bladder caused by a blocked prostate radiates a deep, dull ache directly into the pelvic floor and lower back area. Urological research indicates that persistent pelvic discomfort in men after 60 is frequently tied to underlying prostate inflammation or severe urinary retention. If you have been dealing with a stubborn lower back or pelvic ache that doesn't seem to improve with rest or standard physical therapy, make it a priority to ask your doctor for a targeted prostate exam during your next Medicare wellness visit. Now we have arrived at sign number 6, the highly critical indicator I warned you about earlier, a noticeably intermittent urine stream that starts, completely stops, and then starts again several times during a single bathroom visit. You might find yourself standing there for a long time as the flow stutters, dies down to a slow drip, and then suddenly resumes after you shift your weight or wait a moment. This stuttering stream happens because your bladder muscle is literally running out of gas midway through the process. It strains with all its might to overcome the prostate blockage, gets exhausted, stops to rest for a few seconds, and then tries to squeeze again. According to research from the American Urological Association, an intermittent stream is a primary warning sign that your bladder is reaching its breaking point and losing the strength it needs to function. An excellent action step for this week is to start keeping a simple 3-day bladder diary on your kitchen counter, jotting down roughly how many times your stream hesitates or sputters so you can hand a clear, accurate log to your specialist. The seventh sign is the sudden appearance of visible blood in your urine, which can turn the water anywhere from a light, rusty pink to a deep, frightening red. Discovering blood in the toilet bowl can be an incredibly jarring experience, and it is a symptom that should absolutely never be ignored or rationalized away as a one-time fluke. As the prostate swells, the tiny, fragile blood vessels covering its surface become severely engorged and strained, and when you stretch or strain to urinate, these vessels can easily rupture and leak into the urinary tract. While some studies suggest that benign prostate enlargement is the most common cause of this bleeding in older men, it can also be an early indicator of much more serious conditions, including bladder or prostate infections and malignancies. If you see blood in your urine even once, you need to contact your urologist or primary care physician immediately for a comprehensive evaluation, though you should never abruptly stop any prescribed blood thinners or heart medications without a direct, formal conversation with your doctor. The eighth and final sign is a dramatic increase in the frequency of urinary tract infections or experiencing a burning, painful sensation whenever you pass urine. UTIs are relatively rare for young men, so when they begin occurring frequently in men over 60, it is almost always a sign of an anatomical roadblock. When an enlarged prostate forces stagnant urine to pool inside the bladder for days at a time, that warm, dark reservoir becomes the perfect breeding ground for harmful bacteria to multiply out of control. Many doctors are seeing an uptick in older patients who present with sudden confusion, lethargy, or a low-grade fever, only to find out it is a severe bladder infection stemming from an undiagnosed prostate issue. To protect yourself this week, focus on staying thoroughly hydrated by drinking plenty of pure water throughout the day, which helps continuously flush out the bladder, and make sure to report any burning sensations to your doctor right away. To bring all of this into focus, let me share the story of a patient of mine named Robert. Robert is a 72-year-old retired corporate executive living in Scottsdale, Arizona, who loved spending his mornings playing golf and traveling with his wife. For nearly 2 years, Robert noticed his stream was getting weaker, and he was waking up 3 times a night, but he brushed it off as just a normal consequence of getting older. He adjusted his entire life around the issue, map routing every restroom on his road trips and avoiding long golf games because he was terrified of sudden urgency. He finally came to see me after he spent an entire night in agony, completely unable to pass a single drop of urine because his prostate had completely closed off the channel. After a thorough, gentle evaluation, we started him on a targeted, highly effective combination treatment plan to relax the prostate tissue and shrink the swelling. Within just 6 weeks, Robert was sleeping completely through the night. His strong urine stream returned, and he completely regained his freedom, telling me he felt like he had traveled 10 years back in time. If you want to protect your prostate and your peace of mind starting tonight, here is your 5-step evening plan. First, cut off all liquid intake at least 3 hours before your head hits the pillow to maximize your uninterrupted sleep. Second, eliminate evening alcohol, caffeine, and highly spicy foods from your dinner routine, as these are known bladder irritants that cause sudden urgency. Third, whenever you use the restroom tonight, practice the double voiding technique by waiting 30 seconds after you finish and leaning forward to empty any hidden residual fluid. Fourth, take a piece of paper and begin a 3-day log of how many times you go, noting any hesitation or stuttering in your stream. Fifth, pick up the phone tomorrow morning and schedule your annual wellness check or a dedicated urology screening to ensure your numbers and your prostate are exactly where they need to be. Recognizing these 8 warning signs is a massive first step, but what you choose to eat and drink every single day plays an equally powerful role in how large your prostate grows as you age. In our next video, we are going to expose the 3 seemingly healthy breakfast foods that many seniors eat every single morning that are secretly inflaming your prostate and doubling your nighttime bathroom trips. I am Dr. Carl. Stay well, stay informed, and I will see you right over there in the next video.